Hello, and welcome to Laudio's four-part webcast series, Self-Care for HealthCare. My name is Tom Hills, and I'm a senior executive with Laudio, and I'm so happy to have LeAnn Thieman with me here today. LeAnn is a nationally acclaimed professional speaker, author, and nurse who was accidentally caught up in the Vietnam orphan airlift in 1975. After her Operation Baby Lift story was featured in Chicken Soup for the Mother's Soul, LeAnn became one of Chicken Soup's most prolific writers. Her devotion to more than 30 years of nursing made her the ideal co-author of the New York Times bestseller, Chicken Soup for the Nurse's Soul. Her latest book, Self-Care for HealthCare, Your Guide to Physical, Mental, and Spiritual Health, provides the backdrop and content for this webcast series. Welcome, LeAnn. We're so glad to have you with us today.
It's my joy and privilege to be here. Thank you.
During our four-part series, we'll be exploring caring for oneself, body, mind, spirit, and time. And I thought I'd open our conversation by asking you, LeAnn, why is this topic so important for the nursing profession and its leaders today?
I think in order to be able to give the holistic care that we are called to deliver, we can't give from an empty well. So nurses and healthcare professionals have to be strong of mind, body, and spirit so they can, number one, care for themselves and be more resilient. But secondly, that makes them much more capable to give excellent patient care.
What are some of the challenges nurses tell you they have in focusing on self-care?
One thing, time. I don't have time for this. So we'll be talking about that in this series as well. And I just encourage them to make it a priority in their lives. We're always so busy taking care of other people that we often don't take the time to take good care of ourselves. And so I give them tips and a lot of encouragement to create the time and make the time and put it on the top of their list of things to do so they can nurture their own bodies, minds, and spirits.
Now, what are the risks of ignoring proper self-care?
Well, I think we see it every day, don't we? And nurses are not the healthiest people. When I speak to large audiences, I look out into the crowd, and it makes me sad to see the obesity rate in our profession. I hear my colleagues in nursing brag about not getting very much sleep. And as we know, all of these things really deplete our health and deplete our immune systems that make us more susceptible to other illnesses and so forth. I think that's the top risk, is always taking care of yourself. But I think there's no one that disagrees that if you are totally exhausted, physically, mentally, and spiritually, it of course will impact your work environment, how you relate to your other coworkers, and how you deliver the care you're called to give.
We'd like to spend some time talking now about the first dimension of a self-care program, caring for the body. Can you give us a few tips and strategies to get started?
Absolutely. We're so busy taking care of others, and the strategies that I have are so simple. I often tell nurses and healthcare professionals that I don't teach you anything you don't already know, but don't we all need reminders? First of all, with the care of our bodies, we hear about diet, exercise, and sleep, but we don't practice it very well. To take time just with exercise, to get in at least 15 minutes of exercise every day. Now, there are some people that are up and at 'em and at the gym, and there are others that have much less time to exercise. And running up and down the halls at work doesn't count. We need to have I say 15 minutes a day, because now they find that is cumulative. You can do 15 minutes here, 15 minutes there, and it all adds up. And in our nursing journals, we have research to prove that actually, walking is the very best form of exercise, and it really does decrease your blood pressure and release those wonderful endorphins in your brain and just makes you healthier. And of course, eating. I don't have to tell nurses how to eat right, but I do have to remind them to do so, to pay attention to the quantity and quality of food that we eat. And to eat regularly. There's really no excuse, no matter how busy we are. Sometimes even on our days off, we don't give our bodies the nutrition that it needs. So just to pay attention to do all those things we teach on having a good diet. And probably the most important one that I've been addressing even more today is the importance of sleep. We are really becoming a sleep-deprived nation. I read recently that most 12-hour shift nurses and workers in general get an average of 5 hours of sleep a night. Now, science has proven that the human body requires 7 to 8 hours of sleep in a 24-hour period. And if we don't give it that, there's evidence and research that proves we are depleting our immune systems. We're raising our blood pressures, we're having an increased chance of depression, we have increased fatty deposits. Now that's what gets nurses' attention. So much about blood pressure or whatever, but when I talk fatty deposits, they start to listen. But there's a lot of evidence, and it's been published in our journals, that lack of sleep and improper sleep really does increase the fatty deposits, and which of course contributes to really ill health. So I just remind nurses that the importance of that. And they often say that we set alarms to go to bed at night. I suggest that we set alarms, we set alarms to wake up in the morning. I suggest we set an alarm to go to bed at night. That we need to turn off technology, turn off electricity. 80% of nurses said that they would get more sleep if they didn't have the internet or television. And I'm thinking, who's the boss of them? We need to take ownership of it, set our alarm and go to bed and get some sleep to better care and get our exercise and eat the way we know we're supposed to better care for our bodies.
Now I've got a question for you. My daughter's a nurse, and I hear her talk about her 12-hour shift, and she goes and goes. She doesn't eat. What would you suggest she do to take a pause, to be able to establish a boundary so that she could actually do what you've prescribed in terms of finding time to eat?
Nurses can. We just have to take the time. We schedule everything else. We schedule all the drugs we give to the patients. We schedule all of their therapies. We schedule, when I still remember at the bedside, I had my work assignment and I scheduled the rooms that I was going to go into and what I was going to do and kind of what time were around what all the activities that they needed and the care that they needed. We need to really schedule breaks. And every nurse leader, and I talk with lots of them, that tell us that they really encourage their nurses to take a break. And the nurses say, well, they don't allow me time to. Well, we need to make the time. I remember very well being very busy, and we need to count on each other at work. Will you watch my lights for just 15 minutes? And then we need to sit down and eat. And when you're really busy working 12, it doesn't feel like you have time to pack a healthy meal. But yes, you do. And when you go down to the cafeteria, and I'm a big believer in taking breaks, because we go back fulfilled and renewed and re-energized, and we have a higher energy level, of course, when we consume food. So just making it a priority and not using it as an excuse or a reason for not, and counting on each other to back us up so we can take care of ourselves and each other at work.
That sounds great, LeAnn. Hey, thanks again for your comments today. During our next conversation, we'll discuss self-care for the mind.